රෝබා non-stop සඳහා සිට සිකුරාදා දක්වා සවස 6ට.
Newsfirst, Newsline.
Hello there, a very good evening and welcome to another edition of Newsline. Of course, Newsline is dedicated to discuss political matters, but given the current situation in the country, we have not shied away from discussing the COVID-19 pandemic here in Sri Lanka and keeping you, the general public, informed about what is really happening here in Sri Lanka and how should we act to face this pandemic successfully, to rid our country of this pandemic like we did once before. And to discuss these matters and more, we have with us the Vice President of the Sri Lanka Medical Association, Dr. Weerasinghe. A very good evening, Dr. Weerasinghe, and welcome to our show.
Good evening.
Doctor, first things first, quarantine curfew is coming into effect in the entire Western Province from 12 p.m. today. And of course, the Government Medical Officers Association expressed concern over the fact that this announcement was made yesterday, which resulted in certain people leaving the Western Province because it is being placed under quarantine curfew. Really, before we get into the nitty-gritties of this matter, tell us, Doctor, in short, what are the plans for the future? Especially, will this quarantine curfew be lifted on the 2nd of this month?
It is a difficult answer for me to give. It depends on how things would progress. And it's the curfew and matters like that, those decisions come from a higher level. At a technical level, we have advocated for almost a week now to have restricted mobility in the Western Province. That is what the word that I would like to use rather than a curfew or a lockdown, because restricted mobility is the technique that we want to operate in the Western Province at this particular moment to prevent further spread of infection within the province and also from the province to the outside of other provinces in the country.
So let's explain this word restricted mobility to the people. Is restricted mobility what was practiced in the Gampaha district, where certain police divisions were placed under quarantine curfew, or is restricted mobility something else?
Yes, what I would, coming from a technical point of view, what we think is when people move for any reason in a time like this, you take the virus with you to other places. So that is where the spread happens from one locality to the other locality. There are services, essential services and some key economic services that you cannot stop.
Right.
If you stop that, the whole country is going to stop. So giving that allowance, maybe about 10 or 20% of mobility, if we restrict about 80% of mobility within the province and from province to the rest of the country, we could slow down the virus means going outside a restricted area. That is what I meant by mobility restriction. While telling that, there is a element that very few people are talking about. Within a given locality, we have an infected person A and maybe a suspected people who are the first contacts of them. It's not only the transmission that we are worried from this locality to maybe about 5 kilometers away locality. We are also worried from this house to the neighboring house. So when we are looking at curfew, you just can't look at curfew from a police division and just think that we have imposed curfew and things would be okay.
Right.
Because this mobility, it does not happen according to the police divisions or geographical boundaries. Particularly, we have a road network, right? This road network has to be studied very clearly when we are imposing curfew and mobility restrictions. Unless we go according to these patterns, whatever the curfew you put,
it is still going to spread.
Still going to spread. That is one. Second one, we can't also ignore other ways of mobility. When you restrict a major road, people know where to move out.
By roads.
By roads. So all these behaviors come into play. It's a very difficult task. There's no doubt about it.
And today the GMOA, speaking about this matter, said that certain people had evaded curfew restrictions by crossing streams. Certain people had even used sea routes.
No, I am not going to go that extreme because we are working in the field.
Right.
Whole today I was in the field. So what I am telling is, just after announcing this curfew, because I was there in a particular meeting last morning where key decisions were taken.
Right.
To be taken. So I know the curfew was one at that time, and it was conveyed, and that the decision was taken. But at the same time, when it was announced, we as technical people never expected
it to be announced
at that particular time. For example, the purpose of imposing curfew is to restrict mobility. But if announcement of this could increase mobility, it's counterproductive.
Right.
So for some extent, this has happened already. I am not criticizing, but I am telling is, at least in the future decisions, we have to be a bit cautious about people's behavior. We know how our people in this country think and behave.
Because we are part of the people.
I am not blaming or targeting the total population. Even if 20% of the population think in a different manner, that could be the turning point for the rest of the country in this whole epidemic. So these have to be seriously thought about when we take decisions, and decision for the curfew is correct. There's no doubt about it. But giving more than 24 hours, I think we could have prevented some sort of leakage from Western province to the other provinces.
Right. Doctor, there are certain factions that are calling for an island-wide lockdown. They said, last time that's how we did it. Why don't we try it again?
Very clear. I have a very clear understanding about this. I have analyzed it couple of days back to also. Who are the people asking for a country lockdown when they hear that there would be an epidemic or an outbreak coming? Those are the people who can spend, who can rely on their credit cards, who will run to the store, they will collect everything in the store, they will go home, and they can stay at home without any problem, because they are going to pay their credit next month, maybe from their salary. But majority of the people in this country are not getting a monthly salary. So we need to look at them before thinking of extended long-term lockdown or curfew. Who are going to sustain them? We had that experience earlier for 2 and 3 months. So we should learn from our experience.
Well, we have one question from one of our viewers, and this viewer is asking, will senior citizens be given a chance to exercise for at least 1 hour on the road during the morning hours of the curfew?
I think I have given the answer. What we expect from a curfew, there are very clear expectations. For example, if you look at the Western Province curfew, we want mobility restricted, to have a breathing space for the health sector and others to take a stock of the issues and to clear the backlogs if they have, and to prevent further spread out of this. If you allow people to come to the street in the morning for 1 hour, will this intention be realized? No. What we want to do is to do the maximum within the shortest period of time when we can control things on the ground. If you can't control things on the ground, whatever the measures that you put in is in vain. So that is what we have seen during last couple of weeks in certain places.
So when it comes to restricting mobility, again, you spoke about daily wage earners, and Has there been any structure or has there been any discussion on setting up? We've been dealing with this pandemic for 8 months now. During this 8 months, were there any discussions of setting up a distribution mechanism so that food items, essential goods, and even certain forms of concessions that are being given out by the government, for example, the 5,000 rupee concession, it's been discovered that COVID-19 can linger on notes as well. So to reduce this risk as well, to distribute food items directly to the people in a certain manner. Has there been discussions on a mechanism? Will we see results in the future?
Actually, there have been mechanisms or discussed, but partly the citizens of this country also have a stake in this.
Right.
If you can remember, at the first part of this whole epidemic, by about early April,
right,
to about mid-May, there was a system which was developing, building. New supply chains were being established. People were not allowed and not going to stores. But to a doorstep, certain mechanisms were evolving to deliver dry rations and so on. At that particular time, when there was no options, our citizens were also running behind lorries, for example, and we were looking forward till the next lorry or this non-Chun Pang person is coming. What happened during the last 2 to 3 months? When they were allowed to go out, people were largely contributing to dismantling of this process. People were again going to supermarkets, going to places that they wish, and this mechanism that was evolving stopped completely. Now you have to start it again.
From the beginning?
Yes. The issue is that if this was evolving through, then the government, people would have asked for the government to make it more systematic, register them, give them a health certification, and to make them a very good business rather than getting people onto the street, to the shops.
Right.
But that opportunity is a lost opportunity to the country. That is one. Second one is, I think we lost the cooperative system in this country within the last 2 to 3 decades. If there was the cooperative system that we have heard and seen in our childhood, each village has a cooperative. So the people could sell their stuff into the cooperative and make it a supply chain to the center, and the center could send other stuff to the doorstep into a village. Then this whole supply chain business would have happened. Now we have to re-establish everything. So I think these are the systems and opportunities we lost. At least now I think we definitely need to look at this opportunity to build this country and use those mechanisms that were there 30-40 years back and in a very good form.
Of course, as Dr. Weerasinghe pointed out, we need to start from the beginning again in developing these systems, these mechanisms that we use to effectively fend off the first wave of the COVID-19 pandemic. Many people in Sri Lanka are wondering, when will this curfew be lifted? Well, that question will be posed to Dr. Weerasinghe after this short commercial break. Don't go anywhere. You're watching Newsline.
Newsfirst, Newsline.
Quarantine curfew in the Western Province from midnight tonight until the 2nd of November. Health authorities request the public to avoid violating travel restrictions.
සමහර ගම්වල මිනිස්සු ගංගා වලින් එතර වෙලා පැනලා ගිහින් තිබුණා. මූදු මහර්ගයෙන් පැනලා ගිහිල්ලා තිබුණා. විවිධ අතුරු පාරවල් ඔස්සේ පැනලා යනවා.
New Director General of Health Services requests the public to support the fight against COVID-19. Speaker signs blueprint of the 20th Amendment. Government MPs express contradictory views on US State Secretary Mike Pompeo's visit.
නෑ කිසිසේත්ම නෑ මේක ලංකා රජයේ ආරාධනාවක් නෙවෙයි.
නෑ එහෙම ආව නෙමෙයි. මේ ආවේ අපේ විදේශ කටයුතු අමාත්‍යවරයාගේ ආරාධනයකට ආවේ.
Newsfirst, Newsline.
Welcome back to Newsline. We're in discussion with the Vice President of the Sri Lanka Medical Association, Dr. Weerasinghe. Doctor, getting back to our conversation. Now, curfew has only been imposed in the Western Province. Is this the only province that the risk is most serious in? Or are there other provinces that you are looking at imposing curfew?
I'm not telling that Western Province is the only province, because you see that this from the spread is across the country. So anywhere another sub-group could emerge.
Another cluster?
Yeah, definitely a cluster. And my main worry at the moment, from a technical point of view and from my understanding in the ground level, I think my main fear is the estate sector. Because if you look at, we have got many positive cases, particularly in Hatton town. And Hatton is the hub more than Norelia for the estates.
Right.
So the core of estates in Norelia is actually around Hatton.
Right.
And if you look at Hatton and the surrounding Talwakele, Muskelia cities, those who are from the estates work there.
Right.
And when these are closed down, these people, if they are infected, they will go back to their homes in estates.
Right.
And you know, in their quarters and others, it's a very highly dense,
very compact living spaces.
yes, and people are compact and very small places. Many people live, and their health seeking behavior is a bit different. And they may not come for just a cough and cold to take treatment. And if that seeds is planted in the estate sector, it will be a very difficult situation for us. That is one. Second one is related to the question you asked at the very beginning. 3 days of weekends, and people, if they are expecting further extension, and if they have gone to those places, for example, there are many who are from estate sector working in Colombo.
Right.
And if they have gone within last 24 hours to these places, they may be harboring the virus when they went.
Right.
So if these seeds are planted across the estate sector, it could be a very difficult situation for the health and the country. I think therefore that aspect has to be seriously looked at. It's not only the Western Province. My main fear, the next would be the estate sector.
Right. So moving on from there, what are the steps that have been taken to stop these seeds from spreading, especially, as you quite rightly pointed out, in the estate sector?
I think a few things have been already done. That is why a couple of towns has been closed to prevent people from estate sector again coming to those places. The testing is going on, but I personally feel the awareness campaign targeting those specific individuals and groups.
So those communities?
Yes, communities has to be definitely strengthened within next 24 to 48 hours. And we have to aware them that this threat is there. If you have anything, any symptoms, or if you think that you are exposed, to report to health care workers, because they have to travel quite a distance if they want to go to a major hospital. They have to
or even to meet a doctor, they have to travel quite a long distance.
Yes,
but they have to do that.
I think that there is systems in estates. If you look at, they have to take care of their actually people who are there, and that awareness campaign is what we need at the moment.
Dr. We're in the final few minutes of our show. Let's speak about the ground reality of this entire COVID-19 pandemic and the situation that we find ourselves in. Now, judging by the questions that were coming into the show as well, it's not just food and just existence that people crave. People want to live while they are around. And as a result of that, their mental health, you know, and how people stay at home. When you ask a person to just stay at home, people tend to get frustrated, if I may put it quite blankly. What sort of a plan does the government have now? I know it's not just curbing the spread of the virus, and the government has to really, and the technical side of this has to be thought out quite broadly, but are there any plans on allowing the people some sort of a leeway in, again, like the question that came in, to exercise, to, you know, get some form of gratification at this time when they're confined to their own homes?
You can exercise at your home. You have quality time with your family.
Right.
You are too busy to read a book. You were too busy to really go out from your window and to look at your nature. There are so many things that you can do, and your media. Media has a greater role, not only to convey about corona, educate them on other things, entertain them, and you can glue them to do things.
Right.
So I think that is there. We can't deny that. Still, people will find in enclosed places frustrating. But I think we have to adapt to what we are talking for so long, new normal conditions, till we can get out of this epidemic, pandemic from this world.
So, Doctor, speaking optimistically, at a time in a couple of months, or hopefully in a couple of weeks, when the health authorities, including you, bring this second wave of the coronavirus under control, what should the people really remember? What is their take home from the fact that, you know, we contained the first COVID-19 pandemic, the first wave, then we got complacent a little bit, the second wave came about, now it's worse. What should the people remember when they are acting or when they are living in this new normal?
Very clear, for next 2 years or so.
Right.
Minimum of 2 years, I am telling. You have to adhere to the instructions, the ways that you are taught now. You cannot deviate and relax yourself when you see cases are coming down. No, you can't do it. Because this would be not, different waves would come. You will see for next 2 years or more than 2 years, time to time you are looking at large amount of patients coming. This is the reality. So you cannot relax, authorities can't relax, health staff can't relax. I think this is a huge challenge, at least for the next 2, maybe 3 years.
So there is no interim relaxation period at all?
There are ways of relaxing, but not relaxing by allowing another COVID epidemic to come.
So when you speak about these health guidelines that the people must follow, it's just washing your hands, social distancing, and only going out for essential services? Is that it?
We need to be practical. We can tell 101 things.
Okay.
But for me, I would say, wash your hands regularly with soap correctly. Wear your mask correctly, not on your chin or in your pocket, and make sure that you don't go to unnecessary places which is crowded. And make sure that you keep your distance during next couple of weeks, months, and maybe for a year or so.
Doctor, final question. We have only a few minutes left, so I need to restrict the time that I allow you to answer this question. The World Health Organization has said that there will be a vaccine early, probably next year. So still, do you stick by your prediction of going by the new normal for 2 years?
Vaccines can come. Vaccine itself will not solve it. You have to get the vaccine, you have to immunize your population, you need to get at least 70% of the population immunized. They need to develop their immunity, and then is the solution, which will take at least 2.5, maybe 3 years.
So, Doctor, we have 1 minute left. Is there any final words of wisdom that you would like to leave our viewers with? Of course, given the current situation in the country, any important message?
Definitely make sure you stick to authentic information. Don't carry away with misinformation. Stick to your basic principles and you will be safe.
Thank you very much, Doctor. The Vice President of the Sri Lanka Medical Association addressing you today, joining us on our show Newsline. Thank you very much, Doctor, for joining us on our show, taking time, of course, off your busy schedule. Thank you very much, of course, to all our viewers out there for tuning in. And of course, as Dr. Weerasinghe quite rightly pointed out, do follow guidelines that are issued by the authorities, the health sector, and of course, stay tuned to News First for authentic news, and do not believe or trust misinformation, fake news that are circulating on various forms of media right here in Sri Lanka and across the world. Thank you very much for tuning in to Newsline. We will see you again, same time, same place tomorrow. Until then, take care and God bless.
News First, Newsline.
දැනුමාවට පත්ලා අපි දැන් අවදි වෙන්න වෙලාව පොලිය කරණයෙන් විශාල ධනයක් ලෝකෙට ලැබුණා. දැන් අපේ කණ්ඩායමක් කියනවා අපි සම්පූර්ණයෙන්ම දේශීය ආර්ථිකයෙන් යැපෙන්න පුළුවන්. සම්පූර්ණ ආදායම මේ අවුරුද්දේ බැලුවොත් එහෙම රුපියල් ට්‍රිලියනයයි බිලියන 250. අපි ගන්න ණය පොලිය පමණක් ට්‍රිලියනයි. විශ්‍රාම වැටුප රජයේ සේවකයන්ට බිලියන 200ක් විතර. අපි ওই දෙක ගෙවුවම සල්ලි නැහැ.
නියමාර්ථය ඉරිදා දහවල් 2:30ට